All right, our reporter Tumelo Machogo is in Mbombela in Mpumalanga, and he's about to have a conversation with Health Minister Dr. Zweli Mkhize, who is visiting Rob Ferreira Hospital there. A very good afternoon to you, Tumelo. Take us through the itinerary for the Minister of Health then this afternoon.
Well, the minister actually has started with this visit here in Mpumalanga early this morning, meeting with the minister, the MEC of Health here in Mpumalanga, Mr. Sekane Manzini, and also coming to Rob Ferreira here at the Rob Ferreira Hospital, which is one of the hospitals that has been selected actually to care for people that may have symptoms or may have come with coronavirus here in the province. Let's speak to the Minister of Health, Dr. Zweli Mkhize, to talk to us more about the visit here in Mpumalanga. Minister, just talk to us about the visit here in Mpumalanga, and how was it and coming to this hospital? Are we ready as the province to deal with COVID-19 if people might come to this hospital?
Well, thank you very much. We have come to visit Mpumalanga province. This is my second visit. In the area part of the visit, I went more towards the area of Mbombela, and I went through to look at a number of hospitals there, in particular looking at the readiness in terms of bed availability, in terms of ICU. At that time, I was quite impressed with what was visible, what they showed us, and the staff. The readiness was much earlier on. By then, we didn't have a patient, but then I have now come to look at how the preparations are going now that they have had 176 patients, and out of this they've already got 102 who have recovered. I was given a full presentation of the strategy in terms of how the preparations are going. I must say that I'm quite happy with the fact that they are following properly on the plan that has been put at national level. It's the same plan you will find in Mpumalanga, in the Western Cape, in the Eastern Cape, in Gauteng, and so on. And the emphasis has been very strong on the community side of issues, where they find the patient, an index patient, then they go all out to make sure that such a patient is tested and is therefore taken for admission. And then after that, they go for the contacts, and they've looked after the contacts, take them to quarantine, and that has actually helped to keep the numbers managed. Now, in my discussion with the MEC and the head of department and the senior officials, I've actually praised them for the work that they've done, because we've seen that the numbers have kept within what we call low transmission, which means that for every one patient that they pick up, they need to act immediately to break the cycle of the infection, so that we can keep these provinces amongst those which are low transmission areas. It's very, very important that we do so, whilst they are at the same time preparing in the event that the numbers increase or the patients become more severely ill, and so it becomes important. So I've then asked to have a look at some of the hospitals. They've shown me that there's a lot of work that's been done in Bethal Hospital and in Barberton Hospital. So I came to see the Rob Ferreira to see what's happened. They have admitted patients before. Right now there are no patients, but the wards, the isolation, the triage centers, they've showed me all of that. And in the process, I've looked at the issues of the PPEs, and I've seen that they are well stocked, and so they don't run into problems. The whole province hasn't got a real problem with PPEs, and they've also been able to ensure a very strong and good dialogue between the department as well as the unions, as well as other stakeholders such as traditional healers, traditional leaders, and churches and other non-governmental organizations. So having looked into the hospital, I am quite comfortable that if the numbers were to increase, the ICU is ready. I've met the doctors, young doctors, very enthusiastic. I've met the matron and the nurses, very experienced, and all of them understand what needs to be done. If there is a patient that needed ICU, they'd obviously shift the patients to another part of the province where there will be beds, and therefore they dedicate the beds. Right now they're still going on with the normal treatment, and so we need to then strengthen a number of areas. For example, the issues which are my concern here, one is the shortage of staff. They've raised it with me, and I believe that we need to work together to get more and more staff, particularly the specialized ICU trained nurses. It's an issue. Secondly, they've also put on order a number of ventilators so that they are well stocked, and so I'm happy with that, and we're going to be working together with the MEC to ensure that all those are put in place. As I talk to the doctors, they've indicated to me they are concerned about issues of staffing. So I think that All of that is something that we will be able to work on, because on my way here we've been discussing this issue of getting additional staff. We've also been calling out on private nursing colleges as well as different provinces to send a message out to say people who have been trained, they must look out for where opportunities are for employment as nurses. So we're calling on the nurses and doctors, those who are unemployed, to just liaise with our department so that we can cover the space. But all in all, I must say that we expect that at some point the president might want to visit this place as well. As the president, we have seen he has been to a number of provinces. He's been to Gauteng, he's been to KwaZulu-Natal, he's been to the Western Cape, he's been to the Eastern Cape. This was due to be his next visit, and so at some point it might be, and the deputy president was in the Free State, and that we value that support from the president, deputy president, in terms of visiting out and going to encourage our staff for the work that they're doing.
Minister, there was an outcry here in Mpumalanga over the weekend. That's when the provincial department releases a statement saying that one person actually succumbed to COVID-19, but the person only passed away about 7 days ago. Why was there a bit of a delay for the public to be alerted about the death of this person?
I would normally ask that we don't announce a death until we've got all the information. So there have been a number of deaths which are reported a few days after, and so the MEC did talk to me about it, and then I had said until we were satisfied with the numbers, with the information, we would rather delay the announcement, because in this case what happened, the patient was suspected to be having COVID and therefore was treated clinically as having COVID problem, but we then said we must wait for all the tests to come back. So the test took a few days to come back, but the patient had passed, and so what we normally do in such situations, we make sure that the families are warned that we treat this one as COVID, and therefore we will manage it up until the end. But then I'm very strict with the announcement. I don't want an announcement which we must come back and retract because we didn't have all the results. So I said to the MEC, they rather wait until the patient, the results are all back. I think the patient passed away around the 4th, and we said manage the patient, manage the family and everything, but when we need to confirm, it's different. We need to then make sure that we have satisfied those particular issues. You might recall that the second patient that I announced at the beginning, who had passed, was in the Western Cape. We announced and said there was a patient who had passed, and then a few hours later the test came back negative, and all the doctors said, well, whilst we suspected, we now are saying it wasn't. And so we don't want to keep confusing the public by giving them information that we must retract. So we rather err on the side of caution, and this is what we've done in this case.
Minister, let's talk about the cluster outbreaks that we have seen, especially in the Northwest Province. What are we doing to contain those outbreaks? Because we've seen them now, we've seen them in the Northwest Province, which it jumped just over the weekend.
The clusters are going to happen everywhere, because the clusters arise from people where there's one person who's been exposed and has got infection and are working together. If people don't keep the distance, if people don't use the masks, if people don't hand sanitize, those clusters are going to increase. And that I think we need our people to understand. When we had to do a lockdown and delay the return, we wanted people to understand that there's a change of culture, change of behavior that needs to be emphasized. It is not in the hospital that we're going to contain the COVID-19 infection. It is in the way we behave. Excuse me. It's in the way we all take responsibility of sanitizing our hands, keeping the distance. All of those issues are what in the successful countries have been the major drive. So we want to encourage all our people to say they need to understand that the numbers are going to start increasing when people are going back to work, back to school, back to normal activities, and going to shopping sprees and all of that. When you walk around in the area where people are infected and they've been touching all over, they have no cough or sneeze etiquette, and people have not sanitized their hands and they've contaminated the surfaces, they've not been cleaned, and the people don't wash their hands. The cluster outbreaks are going to happen in such a way that people will have an infection and not even know where they picked it up from. This is the message we've been driving all along. The numbers of people who are COVID positive is much higher now than when we started the lockdown. Right now we're at about 45,000. But when we started the lockdown, we were at 927. Now, it's important for people to understand that at that time we were successful to flatten the curve simply because the driving force was what we call imported cases. So once we stopped people coming from abroad, and we then ended up with only people who are inside the country, we were able to delay the spread. That would have been devastating if we had actually allowed it, because the numbers were going, today would probably be close to 200 or whatever number, very high. But now the numbers are beginning to soar, and their increase, although it's driven by one province in the Western Cape, it's going to happen in all the provinces. The clusters have not been limited only to the Western Cape. In the KwaZulu-Natal, it was a hospital that really had a lot of people. I think we counted at one space 66 people who were in one hospital, who were to do a lot to try and contain that. In Bloemfontein, in Mangaung, we actually had one person, 4 people who were infected, and they turned around to infect the whole number of churches. So we ended up with close to 100 people. It was contained. Now, in the Western Cape, it was in the retail shops, it was in the factories, it was in the food processing factories where the clusters happen. Right now, it's happening in the mines. Mines in Northwest, mines in Gauteng, mines in Limpopo. That's what's driving the numbers up. And when you look at that, you must realize that it's important for people to understand that workplace preparation means screening before people come into work, and that check the temperature, and people must be honest about the symptoms. And it's not about saying people are going to be staying away and you worry about 1 or 2 people. You need to worry about the whole workforce that's going to be infected in such a way that we are now forced to close down the whole operation. And so it's important that we get lots of cooperation from the mining industries, but at the same time, we got good cooperation from the churches. Even at this point, we really don't have much that we can refer to the churches or places of worship, but in the shops, retail shops, in the factories, it's going to be an area where we're going to be worrying about increases. And so that's what's going to happen in a number of areas, and the numbers are going to move faster up because of those clusters, unless we change behavior, ensure that everybody put on a mask. And the issue of the mask, I've been driving around on my way to Mpumalanga. I look out through the window and I look at people as I walk out in some of the towns. Lots of people are having masks, but some of them have put them on their chin. Some of them have got them below their nose. Some of them are holding them in their hands. Some of them are in their bags. In one place, I went out and I said to people, guys, where are your masks? And these were young people. Oh, they remembered. They quickly rushed and put on their bags, they put on their pockets, they pulled out the mask, and they hung them around their necks. I said, look, the issue is serious. You don't need to be seen with a mask. You need to wear it properly. Wear it in such a way that if you've got an infection, it doesn't cross to the other. But wear it in such a way that if anybody's got an infection, because you have covered yourself, you also get less of a chance of being infected. That's a new way of life in South Africa. Unfortunately, then we must keep the gap, the distance between us. We must make sure that the hands are sprayed and people are sanitized and all of that. That's really where the issues are.
Minister, are we getting cooperation from people to actually go out and test and to go out and screen? Are we getting cooperation from the public out there?
The public has cooperated more than enough, and I must say thank you. Thank you to the public, because right now we've actually more than 15 million people who are screened. In fact, that approach to screening, we're going to slowly cut down, because we've now got a fair sense of what the nature of the infection is. We're now going to be focusing on targeted areas where we basically know the indexes. In this area, there's a hotspot. In this area, there are contacts that are going to be found in this area. There are people with comorbidities. Those are the areas we're going to target now, because right now we've done almost 890,000 tests, and that means as we increase the testing, we need now to focus on areas where we know that we're going to use that to not just to find out what is in the society, but to also target on managing, because the issue is you find the people, you treat them, you find the people, you isolate them, you find the people, you get the contacts, to take them for isolation, and keep cutting the cycle of infection. That's the issue that we're emphasizing in the Western Cape, in the Eastern Cape, and all the provinces. This is a low transmission area. They're going to be more vigilant. Test, isolate, test, quarantine, trace the contacts. That's the way. It's got to be like that, and people have been cooperating.
Minister, thank you so much for speaking to us. That was Minister of Health, Dr. Zweli Mkhize, speaking to us about the visit here in Mpumalanga, and also talking to us about the cooperation that the public has been coming out there to actually show people that they're willing to test, they're willing to go out, and also to make sure that they prevent the spread of this coronavirus throughout. This province so far is still has a number of 176 people that have been confirmed with coronavirus, and Mbombela is the epicenter with about 44 cases. Only one death have been reported so far in Mpumalanga. So the province, the minister is pleased with the province and what the province has been doing to make sure that they curb the spread in this province.